Mr. Francis, hi, come on back in. How are you? So where are we at with this?
I'm still bringing up loads of grey green gunk.
Jonathan has chronic obstructive pulmonary disease, or COPD for short. This is a chronic lung condition and it can cause flare-ups where someone can become acutely short of breath and unwell. The plan was to go to hospital. That didn't happen.
We've now got, as we said, we've now purchased a nebuliser now, so I've got one indoors now.
So what are you doing with that?
I don't know. I know how to use
What
them.
made you have choose to buy the nebuliser?
It's to do with what happened in hospital.
Tell me a little bit about what happened in hospital.
My wife's father passed away there.
When was that?
March.
Okay, so that's stopping you wanting to go.
The use of a nebuliser, I've got one now, so I can see how I can go with that.
Because that's not all that you would have in hospital.
No, it'd be antibiotics.
Antibiotics and maybe some oxygen and essentially the monitoring is the issue, isn't it? So it's one part of it's having the drugs, but the other part of it's having the doctors, the nurses, the physios, all the rest of it. That is what will make you get better. The longer this goes on, the more effort and the more strain that this is putting on your heart. And the problem we have is that we run the risk of it suddenly stopping when you're at home with your partner. Well done. Okay, pop your finger in there for me. Let's see what we're doing with that now. Okay. I'm quite concerned. When I listen to your chest, it's just noisy and wheezy everywhere. Your oxygen levels are still on the lower side, and actually what's quite important is that your pulse rate's quite high. To try and get the oxygen around your body, your heart is beating faster and faster and faster. But there is so much that can manage, kind of thing, and then it just stops. Okay, and then we're in real trouble. I really think we need to get you into hospital to get this better. My worry is that this is just going to get worse and worse and worse, and ultimately could be really serious. You might not survive it.
Yeah, then I still run the risk of going, do I get something while I'm there as well?
My feeling is that the risk of you staying at home is much, much higher, and you actually having something that could be fatal, rather than going into hospital and potentially picking up something else. But I think that risk is probably lower.
Okay.
Yeah, so I'm a GP. He's got a really severe exacerbation of COPD. He needs to be admitted pretty soonish. So the ambulance is going to come. I'll come down to the main building with you and we'll go from there. Okay. As doctors, we can only really advise our patients. We can't make them take medication or do a certain thing that we would recommend. And it can be really difficult because you have to try and persuade your patient that what you're suggesting is the right thing to do. Okay?
Just right tight.
Yeah.
It's getting sore now.
I wanted to be respectful of his concerns about being in hospital, but I also needed to know that he understood that if he didn't go, that he would potentially deteriorate much more quickly at home, and that could potentially be fatal.